35 years old, 2,500 grafts. This is unshaven technique. To this day 7, we are seeing again at the donor area and the recipient area, and patients have done a very good smart graft care. Let's have a look at the recipient area now. This is the donor area. This hair is long, so we are able to do 2 quadrants unshaven technique. Let's have a look. Day 7. This is the quadrant upper part. When we lift it down the upper part of the hair, it covers. So this is undetectable, hidden. Patient able to go out in the public without being noticed that the donor area is harvested and hidden inside. Lower quadrant, and it healed well in day 7. So upper quadrant, lower quadrant is hidden with the long hair that covering the harvesting area. Microscope already out. We are looking all the graft that we planted. We are happy to see all the grafts, the angle, the direction intact and rightly placed. We have placed the graft in the frontal temple angle. This is the existing hair, and this area was receded. Today is covered with the hair. The density, the angle and direction are in place correctly. The advantage of this technique is this hair, existing hair, is able to cover the grafted area. Is unable to be noticed by the public, so is able to go out even tonight in the public area without being noticed that he have done a smart FUE